Welcome into Cullman today. I'm Debbie Wood, and our very special guest this morning representing CRMC is Patrick Starnes. Patrick is an RRT. We're going to learn what that is this morning. He's also supervisor for the CPAP Care Center at CRMC. Good morning to you.
Good morning.
You got to tell us, I know you're a respiratory therapist, but RRT, what does that stand for?
A registered respiratory therapist. I'm registered and credentialed to practice respiratory therapy here in the state of Alabama. My coworker Vicki Hembry is also a registered respiratory therapist. So you've got somebody who really knows the ins and outs of your cardiopulmonary system to help you to answer any questions about what is obstructive sleep apnea and how does it affect your body and stuff.
Okay. And you also, I mean, not just at the care center, but you're there if someone in the hospital setting needs you. Is that correct?
That is true.
Am I wrong around?
That is true.
Okay.
We have folks that will have a problem with their CPAP machine when they're in the hospital. They ask us to come take a look at it. We'll have some of our patients that have some questions, and we'll catch up and talk to them about that. Right. Sometimes it's just someone needs education. They don't quite understand, or a family member doesn't understand how to take care of their loved one that has a problem. Okay,
great. And you know, let's talk about the care center just a little bit. The two of you are there. There's also other folks there. Sort of tell us what a typical day is like at the care center. What do you do?
We have a lot of folks that come in, sometimes just a spouse that says, I have a husband or wife that's supposed to be on a CPAP machine to treat their obstructive sleep apnea. Of course, that's where we stop breathing during the middle of the night.
Right.
And they need some advice to try to help get them back on their therapy because they realize they're having some health issues because of it.
Right.
We're there to offer them advice, as well as new patients that come in and want to see the latest mask and supplies, want to see what's new out there, if there's something lighter, more comfortable.
More comfortable. So do you typically, now I know the sleep center is right there close to you, sort of all under the same umbrella, if you will. Do you have to go through the sleep study in order to qualify for the CPAP machine?
You do, because there are so many different types of sleeping disorders.
Okay.
The doctors know if you even have obstructive sleep apnea, because you could have one of 150 something other different disorders.
Okay.
Obstructive sleep apnea is one of the most common, and we treat that typically with some type of CPAP machine, continuous positive airway pressure device.
Right.
And so that's typically the way we go about it.
So that's the way you can, I've done a sleep study before, and once you do that sleep study, then you're able to, or as you're going through that, the technician is able to see exactly what's going on with you.
Exactly. They can determine if you actually have that problem. If so, they would apply a CPAP mask to figure out how much pressure it's going to take to get your airway back open.
Right.
Or you may have a different kind of problem, and they'll monitor that as well, and they'll turn those results over to the board-certified sleep physician who will overread the study and determine what your problem is.
Because you don't always have to have these, and so many of us, you just have a different kind of disorder. Like mine was idiopathic hypersomnia, and where it's hard for you to unwind, I think, and actually go to sleep. So, but now, lots of different kinds of machines from the very beginning of this thing, from the big machines and now they're little.
Yes.
Do people typically trade those things in if they've got the old-timey one?
They do. They will wear out eventually, and they'll start to whine and get a sound. With Medicare, they'll allow you to get a new machine once every 5 years.
Oh, okay.
And with Blue Cross, it's once every 3 years. And so they'll come get something that's smaller and quieter, and many times you might need less pressure, things of that nature. There's different modes that are much more easy to tolerate than they were in the old days. Right. And so we have those type of machines.
Okay. Now, at the same time, folks, as those machines change, the masks certainly change. And Patrick came on a while back and brought a mask, and if you'll remember, Brian Witcher put that thing on and he looked like something from Star Wars, I guess. It was a little bit scary looking. But this is the latest.
Yes.
Now, when we say this is the latest, is this something that you use there? I mean, I certainly know that you could use it there, but is this something that actually people can purchase for their machines?
Yes, it is.
Does it fit all machines?
Yes, it does. That's a good question. All CPAP masks have the same size adapter. Okay. So they'll all fit the same hose. That's not a problem. It doesn't matter if you have a CPAP machine or a BiPAP machine. Okay. Now, this particular mask just happens to go over the nose, and what's so special about it is something that's brand new. We have a lot of patients that have a hard time taking the mask on and off their face. Right. And this particular mask has magnetic clips. So it makes it very easy to take on and off.
Okay.
So they can just put their finger under there, and even if they have rheumatoid arthritis to an advanced degree and their fingers are drawn up, they can just take one finger there and it pops off.
Very easy.
Super easy. And it's super easy to put back on.
Does that strap go around the neck? Or
it does. Head? It goes around the back of the head, the whole of the mask to the face. And this mask is great for folks that are very claustrophobic because there's no forehead piece. So you have an unobstructed vision. So it's just easier for folks to tolerate in case you are one of those claustrophobic folks.
And is any of this, does any of this irritate your skin?
We don't generally have a lot of problems with the irritation. This mask comes with these little covers that makes it extra soft on your face.
Okay.
They're hypoallergenic. They're latex free.
Okay, good.
So it's very well tolerated. We have a few folks with rosacea and things like that, and we also have some ideas for these specialty types of skin disorders when they come in that we can go over their particular problem and see what works for them.
Right. So you try to cover all the bases then.
Exactly.
Now, heated hose, is this a brand new thing?
No, we've had heated hoses for a while, around 2005, 2006, I believe.
Okay.
But at the time, you had to have a machine that could only take a heated hose and nothing else. Whereas now we sell a machine that can take a regular type of hose. It can also take a heated hose or a slim diameter hose like this that's non-heated. So you have 3 different types of hoses you can use on the exact same machine. And what this hose does is it cuts down on condensation inside your tubing. Now what that means is you have a heated humidifier that's attached to your CPAP machine that keeps you from drying out your sinuses as you wear it. But if you're someone like me who likes to keep a really cold bedroom,
I do too.
Cold air and warm air makes rain.
Okay.
Like a cold front and a warm front getting together. So this actually heats the entire length of this tubing to help keep condensation from accumulating inside the hose.
Wow. Wow. Now, everybody doesn't need that though.
No.
And how would you be a candidate? You probably just said that, but give me some ideas on who would be.
If we have someone, again, who likes a really cold bedroom, or we have some folks that their bedroom is not really that cold, but the problem is the vent is situated right beside their side of the bed.
Okay, gotcha. So it's not necessarily a health problem that you've got, it's just the way that to make it a little bit more comfortable.
Right.
Now, and then of course, is that easy to hook up? That looks like it'd be really complicated to me.
Actually, it takes one little twist. You put this on the back of your machine, and you twist it, and it snaps right in.
Okay.
This fits the S9 ResMed CPAP AutoPAP machine that we have. That's one good thing about that particular product is that you have your choice of 3 different kind of hoses, and it fits all of them. You don't have to worry about trying to purchase a new machine or a new humidifier or something of that nature just to get the heated hose.
Okay.
You can switch back and forth.
Switch back and forth, okay, depending on, might be a great idea depending on the time of the year too that it is. Now, what would something like this run? And I know insurance pays for it, but
exactly.
what does this run?
All insurances pay a little different. We have a contract with each individual insurance.
Right.
So when the patient calls us, we can tell you basically what you're asking for is some type of nasal mask. What's important to remember is that basically with almost all insurances, there's 2 kinds of mask. Full face, which covers your nose and your mouth, or one that just goes in your nose or over your nose.
Oh, wow.
So that's the 2 different billing codes. So if someone calls and say, I want to know how much that new mask you have, I saw on television, I'll say, did it go over nose and mouth or just the nose?
Just the nose.
And this one goes just over the nose. We can give you a price for that when you tell us what your insurance is.
Okay, great. And of course that does make a difference. Okay, well, good information this morning. And you know, it's just so good. Those of you that do need this, this CPAP machine, it's just so good to know that they're always constantly trying to make it better, aren't they?
Right, exactly.
And I'm sure over the years, so many people have complained about, I've got some friends that have the big machines, they say, and that they just look, you know, that I think it's probably hard for the spouse too, isn't it?
Oh yes, yes.
To hear that thing.
And what's amazing is that when someone first gets a machine, before the spouse and they hear silence, it's bad because it knows that their loved one's not breathing.
Right.
So they have to get them to start breathing again. Well, once you get a CPAP machine, they are quiet. So they have to get adjusted to the fact that now silence is actually a good thing.
Okay.
Then once they get used to that, they can get much better rest themselves.
So you're saying almost no snoring at all?
Yes, correct.
Because this is...
That takes care of your snoring. It knocks it out.
Wow. Okay. Well, such good information this morning. And if you need more information, that number, 256-737-2753. And we're talking about CRMC CPAP Care Center out at CRMC. And if anybody's got questions, all they have to do is call you, isn't it? Just give Patrick a call. And always good to see you, and thanks for keeping us updated.
Thank you. I appreciate it.
And of course, we'll be back with more of Cullman Today right after this.